Top 30 Assistant Nurse Trainee Interview Questions and Answers. Starting your journey as an assistant nurse trainee requires a strong understanding of healthcare fundamentals, patient care, and teamwork in a clinical setting. Interviewers look for candidates who show compassion, dedication, and the ability to learn quickly in fast-paced environments. This guide covers 30 common interview questions with clear, concise answers that will help you prepare effectively, boost your confidence, and demonstrate the qualities employers seek in a future nursing professional. 1. Why do you want to become an assistant nurse trainee? I want to become an assistant nurse trainee because it's a valuable opportunity to develop essential nursing skills while contributing to patient care. I'm passionate about helping others and learning from experienced professionals. This role will allow me to gain practical knowledge in clinical procedures, communication, and healthcare ethics. It's an ideal step toward my goal of becoming a fully qualified nurse, while ensuring I provide compassionate and safe care to every patient I assist. 2. What qualities make a good assistant nurse trainee? A good assistant nurse trainee should be compassionate, patient, and attentive to detail. Strong communication skills help build trust with patients and colleagues. The ability to follow instructions precisely ensures patient safety. Being organized and adaptable is essential in a fast-paced healthcare environment. Most importantly, a willingness to learn and take feedback from senior staff helps trainees improve their skills and provide better care, supporting both the nursing team and the overall healthcare facility. 3. How do you handle stressful situations in a healthcare setting? In stressful situations, I focus on staying calm, organized, and prioritizing tasks effectively. I take a moment to assess the situation, follow protocols, and ask for guidance if needed. Good communication with colleagues ensures smooth coordination during emergencies. I also remind myself that patient safety is the top priority, so I concentrate on providing accurate, efficient care without rushing. Remaining composed under pressure helps me work effectively and maintain a supportive environment for patients and staff. 4. How would you assist a nurse with patient care? I would assist a nurse by following their instructions precisely, preparing necessary equipment, and ensuring the patient is comfortable. Tasks might include helping with mobility, hygiene, or positioning. I'd observe and report any changes in the patient's condition promptly. My role is to support the nurse so they can focus on medical tasks while I handle basic care responsibilities, ensuring patients feel attended to and valued throughout their hospital or clinic stay. 5. How do you ensure patient dignity and respect? I ensure patient dignity by always treating them with kindness, maintaining privacy, and explaining procedures before performing them. I use respectful language and listen to their concerns without judgment. Even in routine tasks like bathing or changing clothes, I take steps to protect their modesty. I understand that patients may feel vulnerable, so I aim to make them feel safe, valued, and in control of their care whenever possible, in line with healthcare ethics. 6. How would you handle a patient who is uncooperative? If a patient is uncooperative, I remain calm, patient, and respectful. I try to understand the cause, whether fear, pain, or misunderstanding, and address it through clear communication. I explain the importance of the procedure and offer reassurance. If needed, I seek assistance from a nurse or another healthcare professional. My goal is to build trust so the patient feels safe, and to handle the situation without escalating tension or compromising the quality of care. 7. What steps would you take to prevent the spread of infection? I would follow strict hygiene and infection control protocols, such as washing hands before and after patient contact, wearing gloves and masks when necessary, and using sterilized equipment. I would dispose of waste materials according to hospital guidelines. I'd also maintain a clean working environment and educate patients on hygiene if appropriate. Infection prevention is essential for patient safety, and I would ensure all measures are followed to protect both patients and healthcare staff. 8. How do you prioritize tasks when assisting a nurse? I prioritize tasks based on urgency and patient needs. Emergency situations always come first, followed by time-sensitive duties like administering medication under supervision. Routine care tasks, such as assisting with meals or hygiene, come next. I also consider the nurse's instructions, hospital schedules, and patient comfort. Staying organized and flexible allows me to adapt quickly if priorities change, ensuring that critical care is never delayed and that patients always receive timely attention. 9. How do you communicate effectively with patients? I communicate effectively by speaking clearly, using simple language, and actively listening to patients. I maintain eye contact, show empathy, and ensure my body language is open and friendly. I encourage them to ask questions and express concerns, providing honest and respectful answers. For patients with hearing or language barriers, I use visual aids or seek interpreter support. Effective communication builds trust and helps patients feel informed and comfortable during their care. 10. How do you maintain confidentiality in patient care? I maintain confidentiality by never sharing patient information with unauthorized individuals. I follow hospital privacy policies and legal requirements like HIPAA. When discussing patient cases, I ensure conversations happen in private settings. I also handle patient records securely, whether on paper or in digital form. Respecting confidentiality is essential to maintaining trust between patients and healthcare professionals, and it's a responsibility I take very seriously in my role as an assistant nurse trainee. 11. How do you support patients with limited mobility? I support patients with limited mobility by assisting with safe transfers, repositioning, and using mobility aids as directed. I ensure their comfort by providing pillows or adjusting their bed. I also help them with daily activities like eating, bathing, and dressing while maintaining their dignity. I follow proper body mechanics to prevent injury to both the patient and myself. Encouraging small movements and exercises, if approved, helps maintain their muscle strength and improves overall well-being. 12. How do you deal with difficult family members of patients? I remain professional, calm, and empathetic when dealing with difficult family members. I listen to their concerns respectfully and acknowledge their emotions. I explain care procedures clearly, avoiding medical jargon. If their requests are beyond my role, I refer them to the nurse or supervisor. Maintaining patience and open communication helps build trust, reduce tension, and ensure that family members feel heard while keeping the focus on the patient's comfort, safety, and well-being at all times. 13. What safety procedures do you follow in a healthcare setting? I follow safety procedures such as proper hand hygiene, correct patient identification before care, safe handling of equipment, and adherence to infection control guidelines. I wear personal protective equipment when required and dispose of waste properly. I also follow protocols for lifting patients to avoid injury and report hazards immediately. Patient safety is always the top priority, and by strictly following these procedures, I contribute to creating a safe and secure environment for everyone. 14. How do you handle a medical emergency as a trainee? In a medical emergency, I stay calm, follow established protocols, and immediately alert the nurse or medical team. I assist by gathering equipment, preparing the area, or providing basic support such as CPR if I'm trained. I avoid acting beyond my competency, instead focusing on supporting the team efficiently. Staying composed and responsive ensures that professional medical staff can deliver urgent care without delays, increasing the chances of a positive outcome for the patient involved. 15. How do you learn new healthcare procedures quickly? I learn new healthcare procedures quickly by paying close attention during demonstrations, taking notes, and asking clarifying questions. I practice under supervision to build confidence and ensure accuracy. I also review training materials or guidelines provided by the facility. When unsure, I seek feedback from experienced nurses. Staying open to continuous learning allows me to adapt quickly to changes in healthcare practices and provide safe, high-quality support to both patients and medical staff. 16. How do you show empathy toward patients? I show empathy by actively listening to patients, acknowledging their feelings, and offering reassurance. I maintain eye contact, speak kindly, and respect their emotional state, whether they are anxious, upset, or in pain. I make small gestures, like adjusting their blanket or offering water, to show I care. By treating each patient as an individual and recognizing their unique needs, I help create a supportive environment that fosters trust, comfort, and a sense of being valued. 17. How do you handle feedback from supervisors? I handle feedback with an open mind and a positive attitude. I listen carefully without interrupting, take notes if necessary, and ask questions for clarification. I view feedback as an opportunity to grow, improve my skills, and enhance the quality of care I provide. If the feedback highlights an area of weakness, I take immediate steps to work on it. Accepting constructive criticism professionally shows my commitment to learning and developing as a healthcare worker. 18. How do you manage your time during a busy shift? I manage my time by prioritizing urgent tasks, such as assisting in emergencies or patient care needs that cannot wait. I use a checklist to track responsibilities and allocate time for each activity. I remain flexible to adapt if priorities change suddenly. Communicating with nurses about task progress also ensures smooth workflow. Staying organized and focused allows me to balance multiple duties effectively while ensuring patients receive timely, attentive, and high-quality care during every shift. 19. What would you do if you made a mistake? If I made a mistake, I would immediately report it to the supervising nurse, explain what happened honestly, and assist in correcting the error if possible. I understand that patient safety is the top priority, so hiding mistakes is never acceptable. I would reflect on what caused the mistake and take steps to prevent it in the future. Being transparent not only protects patients but also builds trust with the healthcare team and management. 20. How do you assist in maintaining patient records? I assist by accurately documenting patient information, such as vital signs, care activities, and any changes in their condition, as instructed by the nurse. I ensure all entries are legible, dated, and signed according to hospital policy. Confidentiality is maintained at all times. Proper record-keeping is crucial for continuity of care, as it allows the healthcare team to monitor progress and make informed decisions, ultimately ensuring patient safety and high-quality medical treatment. 21. How do you ensure proper nutrition for patients? I ensure proper nutrition by delivering meals according to dietary guidelines provided by the medical team. I assist patients who need help eating, encourage them to eat, and record their food intake for monitoring. If a patient has difficulty swallowing or loses appetite, I inform the nurse immediately. I also respect cultural or religious food preferences. Nutrition plays a vital role in recovery, so my role is to ensure patients receive and consume appropriate meals. 22. How do you handle confidential patient information in conversations? I handle confidential patient information by discussing it only with authorized healthcare personnel and in private settings. I never share details with friends, family, or other patients. I follow hospital protocols and legal requirements to protect sensitive data. Even in casual conversations, I remain mindful of confidentiality rules. Respecting patient privacy is essential for maintaining trust and professionalism, and I take that responsibility very seriously in every interaction, whether written, verbal, or digital. 23. How do you respond to patients in pain? When a patient is in pain, I show empathy and listen carefully to understand the severity and location. I report it immediately to the nurse so appropriate care can be provided. I help position them comfortably, offer water, or use approved comfort measures while waiting for treatment. I remain by their side if possible to provide reassurance. My goal is to ensure they feel supported, heard, and cared for while medical staff address their needs. 24. How do you assist in patient hygiene? I assist in patient hygiene by helping them with bathing, oral care, grooming, and changing clothes or bed linens. I maintain their dignity by ensuring privacy and explaining each step before proceeding. I follow infection control procedures and handle all equipment safely. Good hygiene not only promotes physical health but also boosts a patient's confidence and comfort. My aim is to make the process respectful, gentle, and beneficial to the patient's overall well-being. 25. How do you react when a patient refuses care? If a patient refuses care, I remain calm and respectful. I ask questions to understand their concerns, whether related to fear, discomfort, or misunderstanding. I explain the benefits of the procedure and answer their questions honestly. If they still refuse, I inform the nurse immediately. Patients have the right to make decisions about their care, and it's important to respect that while ensuring they are fully informed about possible consequences. 26. How do you keep patients comfortable during long hospital stays? I keep patients comfortable by ensuring they have clean bedding, proper room temperature, and easy access to water or personal items. I adjust their position regularly to prevent bed sores and check their pain levels. I also engage in friendly conversation to ease boredom or anxiety. Small gestures like offering a warm blanket or playing soft music can greatly improve their experience. Comfort is an essential part of holistic care in any healthcare setting. 27. How do you assist during medical procedures? I assist during medical procedures by preparing the necessary equipment, ensuring the patient is comfortable, and following the nurse's or doctor's instructions precisely. I maintain a sterile environment to prevent infection and provide reassurance to the patient. My role is to support the medical professional so they can focus on the procedure, while also observing and learning proper techniques to improve my own skills for future responsibilities as a nursing professional. 28. How do you adapt to changes in a healthcare environment? I adapt to changes by staying flexible, following updated protocols, and quickly learning new procedures. I understand that healthcare environments can shift due to emergencies, staffing needs, or new technologies. I stay calm, adjust my priorities as needed, and communicate openly with the team. Being adaptable ensures patient care is never compromised, and that I can continue contributing effectively regardless of changing circumstances in the hospital or clinic environment. 29. How do you work as part of a healthcare team? I work as part of a healthcare team by maintaining open communication, respecting each member's role, and supporting one another. I share relevant patient updates promptly and follow instructions from supervisors. Collaboration helps ensure patient needs are met efficiently. I believe in contributing positively to team morale, helping whenever possible, and showing appreciation for colleagues' efforts. Working together ensures the highest standard of care and fosters a supportive, professional environment for both staff and patients. 30. Why should we hire you as an assistant nurse trainee? You should hire me because I bring compassion, dedication, and a strong willingness to learn. I'm committed to providing excellent patient care while supporting the nursing team in all duties. I follow instructions precisely, adapt well to changing situations, and maintain a professional attitude at all times. My focus on empathy, communication, and patient safety aligns with your healthcare values, making me an asset to your team as I grow in my nursing career. Preparing for an assistant nurse trainee interview means showcasing both your technical abilities and your personal qualities. Employers value candidates who are empathetic, adaptable, and eager to learn in fast-paced healthcare settings. By reviewing these common questions and practicing clear, confident answers, you can demonstrate your readiness to contribute meaningfully to patient care. With the right mindset and preparation, you can begin your nursing journey successfully and make a lasting impact in healthcare.